Hello, good afternoon. I'll just kind of give you a brief walkthrough. Yesterday there was a potential patient identified at a local emergency room. The hospital recognized the potential immediately and did all correct steps. We were notified immediately and were on site yesterday as well. We coordinated with state health agencies as well as the Emergency Operations Center at the CDC. We followed best recommendations and guidelines to date. Samples were obtained. Fortunately, the patient had mild symptoms and was improving, so that's a very good sign. With coordination both, again, with the state and national agencies, the testing will be accomplished as soon as feasible, and we will definitely let you know once we get those results back. The patient is being monitored. We've been in contact with the patient today as well and are tracking. Again, fortunately, his symptoms are not severe and he is doing well.
You said it's he?
It's a patient. A&M has been involved as well. We can say that this person is a student at A&M, and we had assessed the situation as being a low risk for the campus community.
So you can't say, or you can say?
We can say.
It is a student at A&M?
Yes, ma'am.
Okay, can you say the approximate age?
No, ma'am.
This question, any idea how many direct contacts the patient made and what airports they traveled through?
I do not know the airport that the patient under under investigation went through, and we are making steps to identify potential contacts.
So you don't know if it traveled through any Houston airport? Or?
I do not. I do not. That information may be available, but I don't have that personally.
Do you know about when they traveled?
Yes, we have a time frame, and this individual did fit the 14-day window for the potential symptoms.
Can you give us like a timeline of like when they got it, or when they came over and when they started feeling the symptoms, and just kind of?
In a broad sense, but not specifically. So the patient had traveled to the area of concern, developed mild symptoms after returning, and then again was improving and doing well. But I think with concern presented for evaluation.
But no like set date, like they just got back on Monday or a specific date?
At this point, I'm not going to give specific dates. There's reasons we want to make sure that we adhere to patient privacy, and we don't want to do anything that might identify this person.
Now you said this is a student. Is he living in a dorm? Are there other students, or is he by himself, isolated?
The patient is currently self-isolating.
You said that he was identified at an emergency room?
At a local emergency room, yes.
Are the people that were also at the emergency room at that time at risk of, like, were they exposed to him potentially, or is?
We do not, after analyzing and speaking with the hospital, they approached this very well and feel that there was no significant exposure to other patients in the emergency department.
Can you confirm which emergency room he was at?
I cannot.
Did other students travel with this student?
I do not know that.
Is he being treated at an emergency room in Bryan, Texas? Story County can kind of give us a geographical area.
It was Bryan College Station.
And what is the protocol if there is a confirmed case?
If there's a confirmed case, contact tracing will begin, and all contacts will be monitored for development of symptoms.
Can you tell us more about what his treatment looks like going forward and how he's been monitoring?
Well, treatment for this particular illness is supportive care. There's not an antiviral treatment for this, so it's just symptom control and supportive therapy. Fortunately, again, for this this person, the symptoms are resolving and improving. So.
Perhaps I missed it. How did he get to College Station from China? Did he transit through Houston, through Dallas? What was his transit path?
I don't have that information.
Okay, are you working on that? Because surely you'd like to know if he has it. how he got here.
Yeah, detailed contact tracing will definitely be involved if this is a confirmed case.
Do you begin that ahead of time, and just in case it's not? I mean, do you start practice now and be vigilant, or?
They've already begun steps for that, yes, ma'am.
Already done it. When you say, could you describe what contact tracing is, what it entails?
It's identifying, again, the pathway and the context that this person may have come in contact with to put him at risk.
And then who he's maybe had contact with since he was possibly exposed, or?
Yes, ma'am.
You look at that as well?
And again, apologies if I missed this, but how did his case come to your notice?
He presented to a area emergency department.
What agency does the test and how long does it take to get the results back?
So the CDC in Atlanta will perform the testing, and once they receive the specimen, it's usually returned within 24 hours.
So CDC Atlanta has to fly in and do the testing?
No, the sample was transported to the CDC,
So it's already been transported?
or in transport.
Okay. And then, because he's on isolation, how are you guys treating his symptoms? I know you said it's kind of just
Again,
management, but
yeah, fortunately, there's, again, no treatment required, and it's, again, fortunate that he had mild symptoms. And again, we're not confirming at this point that he has the disease in question, but it's just routine monitoring with the patient and routine contacts.
So did the local hospital here do the testing and then send it off to the CDC?
The local hospital obtained the samples required by the CDC, and then those were sent to the CDC.
How long will it take to get the results?
Once they receive them, usually it's 24 hours or less.
When do you expect the sample to arrive?
It was going, overnight, so it should be there either late today or tomorrow.
And sorry if you answered this question before, so had this person been to any other public places before going into this medical facility that they went to?
I don't have specifics on all the places this person might have been.
Now, since visiting China, did this person have any contact with her family or go see their family before they came here?
I'm sorry, can you state that again?
So the student that went to China, did he go visit his family before coming back to College Station?
I don't know all the specifics for why he was visiting in China, but
are you guys able to share his nationality?
not at this time.
Is Texas A&M safe to attend?
Yes, ma'am. Texas A&M was made aware yesterday evening as well. So speaking with the physician in charge of their disaster preparedness, and so they're monitoring the situation as well.
So have you alerted local hospitals? Are they taking any extra precautions, looking for anything specific?
All local hospitals, once this virus was made known, we're already taking steps to monitor, and that was part of detecting this early. Those steps were already in place. And we have been in contact with all area hospitals.
What is your main message to the public right now? Obviously, this is a cause for concern for a lot of people just because of what they're hearing amongst all news outlets. So what is your main message for the community to not freak out?
Right. We're in the middle of flu season. There's a lot of upper respiratory illness. So I think general principles are still important, that if you're ill with an upper respiratory illness, it's probably best to isolate yourself just to prevent making others sick. The patient that we're tracking, again, had very mild symptoms, fortunately. And if it's confirmed, then again, contact tracing and additional monitoring will be in place. But at this time, doesn't seem to be anything of concern. It needs to be very closely watched and a lot of detail applied, but nothing that seems out of the ordinary or concerning at this point.
You said that the patient's symptoms were mild. Did the patient go to an emergency room because they had been to China and they knew that that was a risk?
I believe that to be true.
Okay.
Can you tell us anything more about the patient, if they're maybe married or have kids, anything of that nature?
No, but the patient is in isolation. So
So it is flu season, so how do people tell the difference between flu and this?
If you travel to the endemic area, so if you travel to where this is concentrated and you have a significant upper respiratory illness after that exposure, that would seem warranted to get evaluation. But If you haven't had travel to a place where this is a problem, then it's, the flu is everywhere, and so is rhinovirus and adenovirus, and, the routine, non-concerning coronaviruses. They're all here during the winter.
Can this virus be transmitted from person to person?
I'm sorry?
Can it be transmitted from person to person?
I believe so. Coronavirus is transmitted via respiratory.
What's the best way someone can protect themselves from the virus?
Are you talking general virus or this one? Or
This one specifically?
I believe I would just follow the CDC recommendations of avoiding travel to the endemic area.
So I know Texas A&M University has a foreign exchange program with China. Do you know if there's any A&M students over there, since I know you've been in contact with A&M?
That I don't know, ma'am.
What is so much more severe, particularly about this virus than another virus?
Viruses change, mutate, and can gain, different levels of severity. So back in the Spanish flu, that was just influenza, but that was a very significant epidemic. And so occasionally viruses will just have a little bit, I guess, stronger effects, you might say, where it would be more pronounced pulmonary effects.
So that's sort of the concern with this one, it just could be more severe. And what are some of the symptoms, I know you kind of talked about already, but what are some of the symptoms that people could look out for?
Right, most of the symptoms are going to be like mild upper respiratory cold-like symptoms, and I believe most of the cases that have occurred do turn out just to be mild upper respiratory stuff. It's just a few that will progress to severe respiratory infections.
So for most people, they are pretty mild, you would say?
And most of the regular coronavirus infections are fairly mild, just like a cold type thing.
And the deaths that have been attributed to it overseas, have those been in people that have been immunocompromised in some way? As you said, it's a smaller portion of them are getting
Yeah.
a severe.
I don't have specifics on the medical history of those patients.
Do you know the confirmed cases in China as of today?
The total number?
Coronavirus?
I'm not sure the total number. Last I saw was, in the 460, 470 range.
I'm sorry. What was
About 460 to 470 patients last I looked, but that's,
what percentage
that may not be entirely accurate.
So you couldn't say if he lives in a dorm or not, right?
He's self-isolated at this point.
Does he live on campus?
He's self-isolated.
How do the health care professionals kind of address the situation? I mean, given that they don't want to be exposed to it?
The healthcare professionals were fantastic. They did a great job. They took care of the patient well. They, followed standard precautions for themselves. Again, they rapidly identified this as a potential and did all, steps very, very well. And again, they notified us immediately, and so we were present very promptly. So they did a great job.
I mean, do they have to do certain things, obviously, to limit their exposure? I saw in one case they were using robots, I mean, are there certain things that they use to?
No, it's a standard, protection that we do for a lot of infectious patients in the emergency department. So we call PPE, protective personal equipment. So gown, glove, mask, face shields or goggles.
Now, when the patient was in China, was he aware of the coronavirus when he was over there and then decided to get tested here? Or did he realize it whenever he was already back in the States?
I don't know if that question was asked of the patient.
I guess, have you spoken to the patient? How is he feeling with his boot?
So staff here have spoken with the patient, and he's doing well, and was doing well last night, and is very working with us very well to make sure that we get regular updates with the person.
When was he initially
He presented yesterday evening to the emergency department.
And so if it is a confirmed case, how does his treatment change, if it does change at all?
It won't, it doesn't
won't.
change.
Okay.
So if it is a confirmed case, what happens with you guys? What's the next step?
If it's a confirmed case, then contact tracing will be initiated, and any at-risk person will be put on a monitoring system, and so we'll watch for symptom development.
Will they be isolated?
I don't believe isolation is required unless they start developing symptoms.
And then will you guys be able to tell us what airport he came in through and stuff like that?
I have no doubt as this progresses, more and more details will be available.
When would you do your next update?
I think the next update will probably be once we get confirmation, either positive or negative.
Okay, thank you, sir.
Has the person attended the classes before he went to get checked out?
I'm sorry, sir?
Did he get a chance to attend in the classes on campus before he went and got checked out?
I don't know the extent. I'm running on the assumption that he had attended classes prior to his evaluation yesterday.
For those of us just joining us, how was this first discovered?
The patient presented to an emergency department yesterday, mostly out of concern, not out of severity of symptoms.
Can you tell us what kind of symptoms this person presented with in the emergency room? In other words, what should people be aware of that might have been exposed to this person?
Sure. This person had mild upper respiratory symptoms, cough, congestion, that type of thing. But again, fortunately, it was mild and he was improving. By the time he sought evaluation, he was already improving.
Now, you said he attended the classes. So are you notifying those classes to, hey, guys?
I'm running on the assumption that he attended classes. I don't have specifics on that, so we're taking a conservative approach on that, and A&M has been involved.
So are they telling those students, hey, by the way, there was a student in your class who potentially could have the virus?
I believe A&M was moving forward on making sure that all monitoring needed to be in place.
I'm sorry, I didn't get that answer.
I believe A&M was making moves to monitor that and get all those data together.
So you wouldn't happen to know what airline he was on, right?
I do not.
This person came back to the U.S. obviously before the screening started at the 3 or 14 airports over the weekend?
Yes, sir, that's my belief, yeah. I believe he was back, but within the 14-day window.
Sure. Sometime in the last 14 days before the screening started on Saturday and Sunday.
Yes, sir.
Is someone at higher risk for this virus, or is it just everyone?
This virus is probably very similar to most other viruses. So if you've got immunocompromised conditions, including diabetes, chronic steroid use, HIV, autoimmune disease type things, as well as the very young and the very old, those typically are more at-risk populations.
So I know you can't say the specific age, but like a student like in the early 20s, 30s, I mean, you got students all.
I would say 20 to 30.
How concerned are you right now of maybe other potential cases showing up in Texas based on this information?
I think this. I think the monitoring systems that have been put in place very rapidly are extensive and robust. We live in an international world, with rapid travel. Viruses don't typically like to follow borders. And so there's always a potential, but I think the systems that they have, people have moved very aggressively to monitor and screen and prevent. So I think, a lot of effort is going to this right now.
So you say he's returned back to the U.S. within the past 14 days, but you don't know specifically what day or?
We've got some specific dates, but
Releasing it right now.
no, it's within the window that would prompt evaluation. this.
Like just mild symptoms?
No, ma'am. Unless you've traveled to the area of concern,
Okay.
mild flu symptoms or mild cold symptoms are probably still mild cold
It
symptoms.
has not been confirmed yet.
And even if this case is confirmed, this person was in an area of concern, and so without being exposed to this, the risk is not one of concern.
So let's say you're like a diabetic and you work on campus, how can you protect yourself in that, right? If the patient may have already been on campus.
I think this, number one, it's not a confirmed case. Number two is, like I said, we're in flu season. There's lots of upper respiratory illnesses going around, so the same type of thing, hand washing. Again, if people are sick, stay home, don't expose others. But I don't think there's a point of concern right now if you're working on campus for risk of the novel coronavirus infection.
So when will you get the results?
We are optimistic, depending on the way things will run in Atlanta on the CDC, that either over the weekend or Monday.
It takes a few days for it to, I guess, for the results to come back?
Yes, well, it has to get there, so it won't get there till tomorrow, and depending on what time tomorrow, and if it takes 24 hours to run the test, it may get back over the weekend if they're open, or if they're not open, then it'll be Monday.
So not tomorrow for sure, it'll probably be Saturday at the earliest, you think?
I think Saturday at the earliest.
Okay.
I don't know.
Is there a specific reason why CDC Atlanta is doing the tests?
These viruses change. We have tests for coronavirus, but the viruses will mutate, and so the test that we have may not be able to pick that up. And so they have equipment and testing that will specifically identify this particular strain.
So you said that you do have tests for coronaviruses. Did you use those tests on this patient?
No, because the virus that we're looking for, that we would screen for, the test would not, if it was negative, it wouldn't help us. So we didn't bother with that one. But again, I'd like to give commendations to the staff at the hospital. They did a great job. They did everything very well. All right, well, thank you very much.
Can I get your spelling for your name?
No, I'm just kidding. Yes, it's W-I-L-K-E.
What was your first name again?
Eric?
RIC?
Yes, ma'am.
Doctor,
Yes, ma'am.
just want to make sure.
All right.
I'm the right kind of-
All right. Well, again, thank you very much.
Thank you.
Thank you.